Hey everyone, I just wanted to hop on and give an update of what I've learned this last week in school. So, two primary things that we focused on. The first one was manual medicine with all of these kind of subspecialties that fit under this umbrella. So, the first one was massage and various types of massage and certain patients that might benefit from different type of massage techniques. The next one was osteopathy. So if you've ever seen a physician that on the end of their name, their titles are DO, it's signifying doctor of osteopathic medicine. So they undergo the same training as an MD, a medical doctor, but also get some additional training in regards to how to perform certain adjustments to help alleviate pain and tension in the body. The next kind of subspecialty we looked at was chiropractic care and kind of their approach to care and adjustments in the body, certain safety concerns with that, and also patients that would benefit from that therapy, depending on what symptoms they might have. And then the last one was physical therapy. So a lot of people are probably familiar with physical therapists. They deal with and manage a lot of things. I'm very blessed to work with some amazing physical therapies in our rehab unit. But they do a lot with alignment of the body, strengthening of the muscles, mobility, balance, coordination, breath work through movement, and just really bringing mindfulness of how patients are moving and breathing and ensuring safety throughout the body with that. The second thing that we focused on is what's called panchakarma. It's a type of Ayurvedic detoxification. There are five main actions. Of the five main actions, four of them are practiced here in the US. One is more traditionally done in India. So the first one is called Nashya. It's a type of purification of the head or the mind. The next one is Vamana. That one's typically not practiced here in the US, but essentially it stands for vomiting or um, taking things to cause a person to vomit to clear toxins in the body. The next one is called Virachana. So it's a type of laxative treatment for clearing toxins from the body or detoxifying. The next one is oil-based Basti. Basti stands for enema. And then the last one is water-based Basti, so another type of enema detoxification. One thing with detoxification in the body is spices are really important at helping to support our system. Spices have a lot of antioxidants in them, so basically how those are working is with the antioxidants, it's helping to combat free radicals that we may be consuming throughout the day to minimize the toxin buildup in the body over time. Other things that can be really beneficial for helping with detoxification in the body are consuming fruits and vegetables, ensuring a healthy gut microflora. Meditation is really helpful for detoxification, especially detoxification of the mind. And then some type of movement or physical activity, exercise. Some things to help support good gut bacteria, two things that are used in Ayurvedic nutrition. One is called lassi, and the next one is kefir. Hopefully, I'm saying that correctly. But both of those contain probiotics and are really good at helping promote healthy gut bacteria. There were some studies we reviewed about panchakarma and that form of detoxification, but the studies show that panchakarma helps to reduce total cholesterol in the body. It helps to reduce urea levels in the body. It helps to increase physical well being and strength. It also helps to decrease the diastolic blood pressure. So that's that bottom number on your blood pressure. It helps to decrease anxiety, and then it helps to improve cognition. So that's our mental clarity and ability to think. They talked about several personal experiences of patients that had undergone panchakarma. A lot of them with like chronic pain syndrome, such as like fibromyalgia or complex pain syndrome, just really over time doing the panchakarma, significantly improving their quality of life, as well as patients with like multiple sclerosis, as far as helping to um, slow down the progression of the disease, as well as to improve their symptom and overall symptom burden. Panchakarma ideally should be done seasonally. throughout the year. And then they said, as far as like starting Panchakarma, they typically did not recommend it to start it after the age of 70 unless a patient had been doing it for a period of time. But if the body hadn't been used to doing this type of detoxification in patients over the age of 70, it could potentially be very stressful just because it would be something new that the body has never gone through before. It's definitely something on my bucket list that I hope to undergo myself just to be able to experience. And I haven't decided yet where. But here locally in Iowa, in Fairfield, Iowa, there's the Raj, and it's essentially like a resort kind of thing that you would go, you would stay there, and then you would undergo an evaluation, and then they would do your Panchakarma plan from there. And then also some people will travel to India for Panchakarma. And so yet to be determined when and where I'll do that. But when I do, I'll keep you all posted. But thanks for listening. Please comment. Thanks for following my journey. And I look forward to talking to you all again soon. Have a great week. Bye.